I'm Dr. Pete Economo, the East Coast psychologist.
And I'm Dr. Nikki Rubin, the West Coast psychologist.
And this is When East
Meets West.
Pete, so we finally decided to devote an episode to one of our favorite topics, the rules dilemma here, right?
One of your favorite topics.
Well, can I say our? I feel like you talk about rules too. We both talk about rules a lot on this podcast.
We talk about them, but if we were to say who's the bigger rule follower?
Oh, yeah. I'm a huge rule follower. That's true. That is 100% true. But I wouldn't say, but I wouldn't say I deeply love them. I more feel terrorized by them, which is where this dilemma comes in and why I wanted to talk about it.
And many of our clients do. And I joke, but also I'm a rule follower. So I think a lot of us at a certain point, we have a moral compass. Many of us have rules that guide our decisions and our behaviors.
Except I will say, I to this day think about this, and I'm sure people will laugh when I say this because of course I'd never heard this before. Pete was the first person to ever share this saying with me. But you know, the saying of I'd rather ask for forgiveness than permission.
Yes.
I remember he said that to me once, and I was like, wow, what a and I was like, yeah, because I asked for permission. That's definitely that's my jam.
That might just be because I work in several bureaucratic systems, and so
right.
large ones.
Right.
Know, and so that's why. Actually, recently I was like, I don't want to even have a landlord anymore. It's really hard to work with other people sometimes.
It is. Well, it's funny you're saying this, and of course we'll get into some science here in a moment. But I had this realization the other day where I thought, because I worked for myself obviously for many years, and I always sort of, and I love it, and I always thought it's so funny. I've never thought of myself as having like a problem with authority, but apparently I don't like authority. I want to do whatever I want. But that never quite resonated with me when I was and then the other day, I was having a conversation with somebody about it, and I said, it like clicked for me that I realized it's not that I have a problem with authority. It's that I so want to follow the rules that when I work for somebody else, it's so stressful to me. And so when it's just for me, I feel such a freedom that's what it is. It's not that I'm like, screw authority. It's more like, oh, I want to listen to authority. So
anyone that knows Nikki knows that you've never said screw authority.
I've never said.
Never.
Yeah, never.
That may have been the first time those words came out of your mouth.
I usually use a different word than screw, but I'm not going to say it on the.
But we have to make sure we don't have to click explicit.
Yeah, we don't want to click explicit on our podcast episodes. So anyway, so the reason we're talking about the rules dilemma is that even if you're a person listening that says, yeah, well, I am like F authority, or I don't care about rules or whatever. The truth of the matter is that human brains are really into rules, and it has to do with surprise, shocker, language, right? It has to do with language. So we are constantly creating rules for ourselves. So, we've started this discussion talking about sort of like maybe the rules groups of humans create in a society, right? Or like Pete's saying, in a bureaucratic system, but we create rules for ourselves too, right? And so why do we have this tendency? Well, let's like go back to like my favorite example. Pete and I talk about this a lot of like, think about if somebody, when you were a kid, told you don't touch the stove, it's hot, right? Don't do it. So the thing that's helpful about language is that rule, using language, helps us to not have to directly experience the pain of getting burned to learn not to touch the hot stove. That's an advantage. So we're like, cool, thanks evolution. That really helps us out, right?
Yes.
Okay, cool. The thing is, if any of you have ever accidentally touched a hot stove, guess what? You really don't ever do it again, right? What we call in behaviorism, direct contingency learning. So like language is an indirect contingency. You're not actually experiencing something. Directly experiencing something helps you learn it more deeply. And this makes sense because again, our animal friends, they don't have language yet. They learn stuff all the time, right? They learn through experience. But humans, we're like, hey, we've got language. Let's just make a bunch of rules and that's going to keep us safe. Like maybe never share my emotions with my partner.
Yep.
That'll keep me safe, just like don't touch the hot stove.
That's right.
Right. So
Yes.
I'm going to pause for a second before we get deeper into rules. But yeah, Pete, what, like, is this something that you talk about a lot clinically, or like, what do you want to add here?
Yeah, all the time. I mean, I certainly frame within like the rigidity, it's that, and I think it's always tough because especially if you think about multiculturalism, which we've done several episodes on, that sometimes rules are really based in culture. And so while it might feel like it's really disaligned or unaligned with this person in this moment, there's some like real deep sort of rooted belief system there.
Yep.
So I love that work, is just helping people understand sort of the root of some of these rules.
Yes.
These rule governed behaviors, as we often talk about within, third wave CBT. I did want to give you did you know that the APA has like a psychology dictionary?
I did not.
Well, now you do. You're welcome.
Okay, well,
and
hopefully I like them a little better than
you do, because I've given you one or two.
Oh, and then I'm like, oh yes.
Yeah, you've actually liked these better. So, rule, a guideline or standard that is used to guide responses or behavior, or that communicates situational norms.
Correct. Right. So that's right. Yes. Okay. All for you in this situation. APA. Yeah. Well, and so to that point, what you're saying about culture, right? So really, we could expand this. Just it's to context, right? Like
Correct.
Humans, we create rules, right? We create rules. We create. I'm going to put in quotes. If you're watching our YouTube channel, you can see me doing my air quotes, norms in quotes, right? Standards in quotes. And some of those are helpful and some are not, right? Like don't touch the stove. It's hot, right?
Helpful.
But helpful, right? Don't share your emotions with your partner. Unhelpful, right? Right. Disregard this other group of human beings because of what they believe or how they look. Unhelpful, right? So it's really just like helpful for people to understand, though, that this is the rules are constructs that our brain creates.
So what I hear you saying, Nikki, is that so would you say rules create dialectics? Do they force people sometimes into dialectics?
Oh, I would not say that.
Oh.
I would not. I would say rules they force people down the opposite path, right?
Oh, well, that's okay. So I'm saying the same thing I just said it the wrong way.
Oh, you are? Okay. Okay. So what?
Well, because rules kind of
opposite of dialectics.
I know. Yeah. So I was thinking of so rules are like the antithesis and the thesis.
Okay, sure. Yes. Okay, sure. We can say it that way. Totally.
So it's sort of like right or wrong is kind of it's almost like people are forced into that.
Yeah, but I guess I would say it more that I wouldn't say they're forced into a dialectic, because I think they're forced into the rule. They're forced into doing what the rule is saying. Right. So rules again. So let's, I think it might be helpful to like focus on like a clinical example. Right. So like, let's say that somebody comes in with a rule. I've obviously used one example already, but comes in with a rule that they have.
What's your example? What's your example you're going to do?
Oh, I didn't have one. I was thinking on the fly. It was percolating as you were talking. Well, good. You have one.
I don't know. I have one, but I don't know if it's a good one, because I feel like there's so many rules. And so let's like come up like three. So like what, maybe a rule would be like, I can only have sex with one person if I'm married. Is that a rule, or is that a moral?
No, that's a rule. Well, that's a rule. No, so rules are just exactly what you said. They're saying this is the way it is. And let's be clear to everybody listening. It doesn't mean you shouldn't follow or have rules. We're not saying that. We're saying rules can serve a function. They can be helpful. Where we get stuck is then we believe whatever rules our minds have created, or society's created, or your family, or whatever it is, that those have to be followed.
That's right.
And that's where the problem lies. That's what gets in the way of psychological flexibility.
So I can only have sex with one person in a relationship. I can't eat Oreos when I'm stressed.
Right. Or it could just be, or I can't eat Oreos, right?
Period.
Like I can't eat Oreos, or when I'm stressed, right?
Right.
I should get straight A's.
Got it. Okay. So there's three. So, okay.
There's three. And we could go on and on and on with the rules, right?
Countless.
So countless, right? Maybe this is important to say too. These are, sort of like, little clues that something is a rule, right? So if we go real second wave CBT here, we would say they're like assumptions or rules, like shoulds, have tos, musts, need tos. I like supposed tos, which I call fancy shoulds. So, like sometimes people get like patients get wise to it and they'll be like, oh yeah, I know. I'm not supposed to say a should. I'm supposed to get straight A's. I'm like, yeah, that's just a fancy should. Yeah. Same function.
Probably on synonyms.
Right. But like other, assumptions might be if some, like, here's a rule, or an assumption slash assumption. It's like femininity is weakness.
Mm-hmm.
Right.
Mm-hmm.
That's when
boys don't cry.
Exactly.
Yeah. Okay.
So, as we are saying these things, I want listeners to think about how does that then impact what we do?
Correct. The
behavior. So that's why in ACT, we talk about what are called rule governed behaviors, meaning behaviors that are governed by the rules our minds have created. Right.
So boys don't cry. That was your dissertation.
Basically, yes. Okay. And so, and that
so
would
break
be
that
one,
down.
Well, so we would say, so that's one that, okay, so that's a cultural rule that exists in, I would say in many, many cultures, right? I wouldn't even just say most, if not all, right? That, men are not allowed to experience sadness and also like anxiety. That's another one. Like I work with a lot of men that struggle with anxiety and a lot of shame about that.
I've never had anxiety.
Right. No, never. No, me neither. No.
Yeah.
Right. And so what's that going to do? So it's like, so think about somebody. So if there's, if you, if you're a man and you, again, let's say a really meaningful relationship ended, or you just lost a loved one and you feel immense grief and sadness and you start to feel tears, but your brain's like, nope, boys don't cry. What are you going to do? You're going to, have you experienced that, Pete, where you're like,
last week,
where you like, shut it, where you say, shut it down? Shut it down.
Yeah, I didn't shut it because I let it come. But, this is, it's really validating to hear it because it's a lot. So I love that you went to this like really deep example of like losing somebody. I'm also just thinking like coach yelled at me. I lost the game.
Right. That too.
My girlfriend cheated on me, something that's like less sort of, serious, if you will.
Right. Sure.
But then they push the emotions away. Absolutely. Yeah.
Right. And so then there becomes this problem where a person is now not allowing themselves to experience the fullness of being a human.
That's right.
Right. So like when in this particular example, like when I'm working with male patients, I'll say, look, you and I both have human brains. Right. The difference is you're told a story. You're not allowed to have emotions like sadness. And I'm told a story that I am.
Right.
Right. And so that's going to impact what we do in different ways. Right. So we talked to, so this episode, we're calling it the rules dilemma, right? So like, it's a dilemma because our brain, like, I guess I'll pose this question to you, Pete. So
no, I was going to pose it to you. I was literally just thinking that.
All right, fine. Go for it.
So go. I mean, what's the dilemma with rules?
What's the dilemma? Well, the dilemma is that, rules in the short term oftentimes keep us safe.
Yeah.
Right. That's why it evolved. Don't touch the stove. It's hot. Look both ways before you cross the street. Right. Don't go out into that field. Saber-toothed tigers are wandering out there. Right.
Don't cry. Because if you live on the street and someone sees you cry, you're then seen as weak.
Yeah. Yes. Right? And so we can't judge our brains for trying to, again, as we always say, to protect us. Right. Yeah. Most functions that don't work that well overall have some utility at some point along the spectrum, right? Yes. Like at some point they're trying to protect us. Mm-hmm. We just want to be able to recognize that, like, when are these rules not working anymore? Like, when is it not working? Like, don't, look both ways before you cross the street. For the most part is going to be workable, like in almost all contexts. But even that, I'll say to somebody, I'm like, what if you're in the middle of nowhere? Let's say you're on an island where there's no cars. There's like, I've been to an island where there's no cars, right? And there's literally no people, no humans. I'm not saying don't look both ways, but I don't know. Is that rule really that helpful in that moment? Probably not, right?
I like that one.
Well, because the idea is that, again, like in this concept of like trying to move towards psychological flexibility, it's like getting curious about what behavior is actually workable, and can we get kind of wise to this tendency of our brains to say, no, follow what I'm saying. Right. It's like, okay, like I hear what you're saying, but is that behavior, like, is not crying, is not eating the Oreo, are getting straight A's, like, is that actually working for me? Right.
Right. Yeah. So what do you do with that? So clinically, you help people, because I know I go in and I just help understand how they align with values, really understand some of the roots of it. I think cognitive behavioral therapy, sometimes we're judged for not going down to some of the roots of issues or whatnot.
Which is not true.
Yeah.
Punchline, not true, but yeah.
And so like here would be a place where we would really go down. Like we would really want to break down, understand the rules, like, break them down. What are the assumptions that are, underlying these rules, and then the certain behaviors and consequences that are, created from these.
Yeah, no, I mean, exactly what I would do. And I think I spend quite a bit of time though, really helping people, well, one, understand like why we even have rules, right? Like, and then also, I guess it's important to say, also helping them understand that like, you don't have to do what the rule says. Like sometimes, Pete and I are, obviously these are like little 20-minute on average bite-sized podcast episodes. This can, we can believe rules really deeply. You know what I mean? Like, goodness, like the vulnerability thing, like that's one, like, I don't know a human that doesn't have some rule around like, don't be vulnerable.
Right.
Right. Like, like we all are afraid of that.
Oh
right?
Yeah, absolutely. It's like constantly the work that I do. And that's why I was referencing your dissertation a bit, because you did just for listeners, it was about depression with men in a very general sense. Yeah. And so it's because I work predominantly with men, I see it all the time where we're so afraid. And I'll just share, because I know we're almost getting out of time, but what I referenced last week was just, having to attend a funeral, and where I really, I felt very off for a few days after I learned of this loss. And then I attended the funeral, which was really, really healing for me. And the moment that I felt the tears coming, I felt like I wanted to run out.
Yeah.
I felt like how uncomfortable it was. And then when I allowed them to be there, a couple moments later, it was just really such a beautiful experience, and one that I was really thankful to have.
Yeah. Thank you so much for sharing that, Pete, and I know how difficult that was for you. I think what's helpful about hearing that is to say that, like, look, Pete's brain has a really overlearned rule that's been culturally reinforced throughout his life, right? Boys don't cry, especially in public, right? So it's like, especially in public,
especially when, and I'll just put myself out there. Like, so Nikki and I are psychologists. And so I feel that we're sort of expected to either have the answers or to be able to, my favorite word, control our emotions. And yet it's just human.
And so, by choosing in that moment, like he said, he's noticed, you were noticing to engage in the rule governed behavior, which is like, run away from this, don't show this, don't feel this. Pete chose to instead allow, right? He allowed himself to contact that. And so this comes back to experiential learning, that when we actually allow ourselves the opportunity to do the opposite of what an unhelpful rule is telling us to do, our brains actually learn more deeply that these other behaviors are more effective, more workable for us. But it requires a willingness to take a leap and try something that is going to feel really unpleasant. So thank you so much for sharing that example, Pete.
Thank you for your wisdom.
Oh, well, right back at you here. So, listeners, just consider the rules dilemma, right? Get curious about what are the rules your mind has created for you individually. Maybe get curious about the rules you experience in your family, in your friend group, in your culture, in your country, any of the contexts that you move within. And just know that not all rules are designed equally. Not all of them are helpful. And can you choose to move away from ones that don't work for you?
This has been When East Meets West. I'm Dr. Nikki Rubin.
And I'm Dr. Pete Economo. Be present, be brave. This has been When East Meets West. All material is based on opinion and educational training of Drs. Pete Economo and Nikki Rubin.
Content is for informational and educational purposes only.